Since cardiovascular problems can range from irregular heartbeats to high blood pressure, doctors use a wide range of drugs to treat them. This classification contains medications that help correct irregular heart rhythms, chest pains, and high blood pressure. To keep the cardiovascular system in the best shape possible, there are medications that help control cholesterol, strengthen the pumping action of the heart, and help prevent potentially life-threatening clots. Many of these medications may have effects based on the person's response to them. Close monitoring and reporting of any concerns to the doctor, be they the person's or yours, is essential. Anti-hypertensives are used to treat high blood pressure. All stages of high blood pressure are linked to an increased risk of cardiovascular and kidney disease. The goal of anti-hypertensive therapy is to reduce this risk. Medication is not the only answer. Lifestyle changes are a significant part of treatment. These lifestyle changes may include weight loss, regular exercise, decreasing sodium in the diet, smoking cessation, and moderation of alcohol consumption. The choice of which drug to use is based on pre-existing conditions. For the therapy to succeed, the person must not only adhere to the drug therapy, but also make and maintain needed lifestyle changes and keep follow-up appointments. Let's look at some of the drug groups that may be used to treat high blood pressure. We will look at them in depth as we progress through this section. Common drug groups used to treat high blood pressure include diuretics or water pills, ACE inhibitors, angiotensin receptor blockers, ARBs, beta blockers, and calcium channel blockers. Arrhythmias, which are problems with the heart's rhythm, cause significant illness and many deaths. The problem may be that the heart's rate is too slow, or it could be too fast. The problem may originate in the atria, or the top of the heart, or the ventricle, which is the bottom of the heart. Problems in the upper part of the heart do not have as much of an effect on the heart's function or output as do issues in the lower part of the heart. Common medications used to treat arrhythmias include procainamide, quinidine, lidocaine, propafenone, propranolol, amiodarone, verapamil, and cardizem. If the person is taking antiarrhythmics, remember the person should take the medication exactly as prescribed. Take his pulse before the dose. If less than 60, call the doctor for instructions. Don't stop taking the medicine without talking to the doctor. Keep follow-up appointments with the doctor. Report adverse effects such as constipation, diarrhea, chest pain, ringing in the ears, unusually fast or slow heart rates, or rashes. Another medication that is commonly used to treat heart problems is digoxin. Digoxin strengthens the heartbeat and relieves ankle swelling, shortness of breath, and fatigue that can accompany heart problems. Be sure the person takes the medicine as prescribed at the same time each day. No over-the-counter medications or herbal products without approval from the doctor. Routine physical exams, cardiograms, and blood work are important. All follow-up appointments should be kept. Report adverse effects such as changes in heart rate or rhythm, nausea, vomiting, and vision problems. The person should limit salt intake and be sure he gets enough potassium. Follow your doctor's nutritional guidelines. Don't use salt substitutes without written permission from the doctor. Take the pulse as instructed by the doctor before each dose. If it is less than 60 beats per minute, call the doctor. Don't crush digoxin capsules. Only crush tablets if written permission has been obtained from the doctor. Carefully measure liquid form of digoxin to prevent overdoses. Beta blockers may be used to treat many things, but generally they are used to treat chest pain and high blood pressure. Beta blockers decrease the blood pressure, heart rate, and the force of the heart's contraction, which reduces the heart's demand for oxygen. Important drug interactions to be aware of include antacids delay absorption of beta blockers. NSAIDs can decrease the blood pressure, lowering the effect of the beta blockers. Beta blockers can increase the risk of lidocaine toxicity. Beta blockers can affect the effectiveness of diabetic medications. Adverse reactions to watch for include slow heart rate, chest pain, fainting, nausea, vomiting, diarrhea, swelling to the hands and feet, and fluid retention. Suddenly stopping a beta blocker may cause chest pain, high blood pressure, irregular heartbeat, or heart attack. Nitrates are often used to help relieve acute chest pain. Nitrates cause veins to dilate by working directly on vascular smooth muscles. The majority of the dilation occurs in the vein, but they also work on the smooth muscles of the arteries. One of the most important things to remember is that if your person is taking Viagra, Cialis, or Levitra, they make sure the doctors and nurses are aware. If you give a nitrate in combination with one of these drugs, you run the risk of severe, life-threatening low blood pressure, which could result in death. There is also an increased risk of orthostatic hypotension, like when you get up too fast from bed and you feel faint like you're going to pass out, if they are taken with a calcium channel blocker. Common nitrates include amyl nitrate, also known as poppers. Remember, the combination with Viagra or other erectile dysfunction medications could be deadly. Isosorbide dinitrate, isosorbide mononitrate, and nitroglycerin. ACE inhibitors are used to reduce blood pressure. They promote the excretion of sodium and water, thereby reducing the amount of blood the heart needs to pump and reducing the blood pressure. They may be used alone or in combination with other medications to treat high blood pressure. ACE inhibitors are commonly used when beta blockers and diuretics are not effective. ACE inhibitors, such as lisinopril, are used for patients who have had a heart attack to improve survival rate and reduce morbidity and mortality in patients with left ventricular dysfunction. ACE inhibitors can cause several different types of interactions with other medications used to treat cardiovascular problems. They enhance the blood pressure lowering effect of beta blockers and diuretics. They may also increase the serum levels of lithium, thereby increasing the risk of lithium toxicity. When ACE inhibitors are taken with potassium-sparing diuretics, potassium supplements, or potassium-containing salt substitutes, the person runs the risk of developing high levels of potassium in the blood. Dependent on the potassium level, this can become a life-threatening situation. Another group of medication that should be avoided while taking ACE inhibitors is NSAIDs. They may decrease the blood pressure reducing effects of the ACE inhibitor and may also alter kidney function. Food and antacids may decrease or impair the absorption of ACE inhibitors. ACE inhibitors can cause problems with fetal circulation and should not be taken during the second and third trimesters of pregnancy. Oral anticoagulants are the drug of choice to prevent deep vein thrombosis, also known as DVT, which are clots in the deep veins. Treat people with problems with their heart valves, and to treat people with atrial fibrillation. Coumadin is a common anticoagulant you may see. It may be combined with an antiplatelet drug such as aspirin or Plavix. Antiplatelet drugs are often used to prevent venous and arterial clots that may travel to the heart, causing a heart attack, clots that go to the brain, causing a stroke, or clots that move to the lungs, causing a pulmonary embolism. It is very important to follow dietary restrictions, particularly not changing the amount of vitamin K which is found in green leafy vegetables when taking Coumadin. When taking Coumadin, the person will need to have routine lab work completed to be sure he or she is getting the proper dosage. Remember, if the person is taking an anticoagulant, it is important to take them exactly as prescribed. Take Coumadin in the evening. Generally, it's ordered for 5 p.m. Watch for signs of bleeding, unexplained bruises, vomit that looks like coffee grounds, and black tarry stools. Remove safety hazards to help reduce the risk of injury. Be sure that routine lab work is completed. Don't increase green leafy vegetables or foods and vitamins with vitamin K when taking Coumadin. Other anticoagulants on the market do not require routine blood work, do not have dietary restrictions, and only target specific clotting factors. Xarelto and Eliquis are 2 examples. Remember, if the person you are caring for is taking an anticoagulant, watch for signs of bleeding such as coffee ground emesis, black tarry stools, excessive bruising, and excessive bleeding gums. Another consideration is to be sure that direct pressure is placed for at least 5 to 10 minutes on the puncture site when blood is drawn. If not, he or she may have a large bruise at the venipuncture site. Antilipemic drugs are used to lower abnormally high blood levels of lipids such as cholesterol, triglycerides, and phospholipids. The risk of developing coronary artery disease increases when serum lipid levels are elevated. In addition to drug therapy, diet, weight loss, and exercise in treating the underlying cause can help reduce the lipid levels in the blood and decrease the risk of coronary artery disease. The 3 groups we will be looking at are the statins that lower lipid levels by interfering with the production of cholesterol by the body, Zetia, which inhibits the absorption of cholesterol from the intestine, and niacin, which will decrease triglycerides and increase HDL, good cholesterol levels. Statins may alter liver function and cause elevation of liver enzymes. Other effects may include pancreatitis, hepatitis, jaundice, and cirrhosis of the liver. Muscle pain should be reported to the doctor. It may be a symptom of myopathy or rhabdomyolysis, which are rare but severe and potentially fatal adverse reactions. When a person is taking cholesterol medications, be sure he or she takes the medication exactly as prescribed. If the drug is a bile sequestering drug, like equestrian, never take the dry form. Esophageal irritation or severe constipation may occur. It must be diluted as directed. Diet is an essential part in controlling cholesterol and serum lipids. Drink 2 to 3 quarts of water a day. Report severe constipation. Report unexplained muscle weakness, pain or tenderness, especially if accompanied by malaise or fever. Have periodic eye examinations. Be sure you have routine liver function blood tests, generally before and at 6 to 12 weeks after beginning the therapy, then periodically after that. Report any jaundice, which is skin or eye whites turn yellow.